I'm Tim Malloy with Palm Beach TV and the Civic Association. And this is part 3 of our ongoing series, Your Town, Your Safety, Your Well-Being. Our Healthcare Committee asked us to do some brainstorming and come up with the important issues to people living in this town. And we did so, a couple of them. Let's start with this, finding good, safe, reliable home health care.
I didn't know really where to begin at all as to how do you find competent help.
It's an unusually stressful time for the whole family, and most of us have no experience with this.
It often happens fast. Suddenly your loved one becomes ill or unable to care for herself, and family must quickly find reliable, safe home healthcare aides to bring into the home. So how do you do this when most of us have no idea where to start? In the following program, we will talk to the experts and those who've been down this treacherous road to learn best practices when hiring home health aides. Florence Greenberg was a vibrant 89-year-old, playing golf, shopping with her daughter Judy Goodman, until quite suddenly her vitality and good health took a dramatic downhill turn.
Almost on a dime, try to find home health care.
Leah Mazer, mother-in-law of Palm Beach Civic Association Director Jeff Levitt, passed away under the care of hospice. Her family only later to discover that jewelry and other valuables were missing.
On a 24/7 basis, there could have been as many as half a dozen to 8 people per day in and out of the apartment. And that ranged from nursing staff or aide staff or physical therapy staff, as was required. But we couldn't keep up with it.
Finding well-trained, qualified, trustworthy healthcare aides to bring into the home of a sick relative is a task many of us will face sooner or later. And although it is never easy, there are ways to go about it that will increase your odds of finding the right person or people to fill your home healthcare needs.
You can start out by looking into agencies, registries, or a private referral from a family friend is always a good source if they did a background check.
Nancy Rowe is the owner-operator of a nurses registry and has been working in the field for 50 years. She says making sure to perform a national, not just single state background check on a potential aide is the first step to weeding out those with criminal or unsavory backgrounds. Even after the requisite background check, some bad apples can slip through the cracks.
I can remember one person we actually hired and who didn't last the weekend because it was a nighttime shift, and when we checked, she was asleep in my mother's room in her bed. And when my mother woke up in the middle of the night, which was a frequent situation, she was terrified to find someone in her bed.
Lesson learned by Goodman and her siblings.
Don't be afraid to make a change no matter how much you need the help, because if it's not right, your loved one is suffering. They often do know what is the best and appropriate person for them to help them, and they are most apt to tell you right away if it's not right.
Occasionally, it is incompetence that requires family to find a better fit for the care of their loved one. Other times, it comes down to a clash of personalities. But Nancy Rowe says in most cases, families should give a new caregiver a day or two in the home.
We try to get the client and the caregiver to try it more than 1 day, 2 days, because sometimes that first day or two is very stressful and nobody is on their mark. So I feel there's an adjustment period they need to get through before they tell me this is not the person, unless they really did something that was wrong.
As to that nagging worry that the person you trusted with the care of your ailing relative may not be trusted with her valuables, Levitt and his wife reflect on what they could have done differently to avoid potential theft.
One thing we could have done in hindsight was to probably secure many of the items of jewelry in a more secure place and place things in different places. She was in the home at the time. Not everybody's in that situation, but the home has to be protected.
Patients have to help us a little bit here with the temptation. because you could have a good person who will do something stupid just because of temptation, like lots of jewels laying around, lots of cash laying around.
Another gray area, asking your home health aide to do housework.
We'll get things like, can you mop the floors? Or they're not going to do those things unless there's a mess they have to clean up.
Hiring home health care is expensive. $25 to $30 an hour, more for nights, weekends, or holidays. This alone can stress an elderly patient to the point of refusing the care they need.
Often older people are very conscious about it's costing a lot of money, so it's probably helpful not to show them the bills.
Though extremely expensive, often the elderly or ailing patient may not require the exclusive attention of a registered nurse, which may reduce the financial burden of care.
It's not always necessary to have a nurse. Sometimes you can have a nurse come in, just do a nurse visit, pour out the medications for the patient, so that the nurse's aides that come in after a cheaper form of care, half the price.
Then there is the frequent issue of a patient's overdependence on one single caregiver.
Here's another expectation. We want the same caregiver every day, 7 days a week. Well, that's not going to happen. When I can change the client's mind and allow 2-day relief for somebody else to come in, mainly because if that one person gets sick, you are stuck with all new people for 7 days.
Fortunately for Palm Beachers, there is a way residents who find themselves in the position of hiring a home health aide can start off that relationship on the right foot. It's a forward-thinking program offered by Palm Beach Fire Rescue to meet and educate the new aide.
It's an educational visit, it's an expectations visit, we'll get to know the resident, we'll get to know the caretaker, they get to know the fire rescue personnel, and we're on the same page as far as why we're here, and it's the overall care and well-being of the resident. And really sticking to what our mission statement is. Every encounter is an opportunity to positively impact the lives of our residents. That's the goal, and that's what we want to do.
This form, the Palm Beach Civic Association's File of Life form found on our website, is an integral part of the fire rescue home visit with a new home health aide, one that could save the patient's life in the event the aide must call 911 in an emergency.
If they have the information that I need, medical history, allergies, what medications they're taking, emergency contact information, preferred hospital information, physician information, and what family that resident would want us to call at that moment, that we can make that phone call. That really advances the process of us figuring out what the emergency is and getting them over to the care that they need rapidly.
Final advice on how to start this daunting search?
As a consumer, what is your advice to start this in the right way to end up with the right person?
Call around, start getting prices, their way of doing things. See if you have a long-term care policy also.
So check to see if your relative does have long-term health care insurance coverage, though most people do not have it, leading families to have to dig deep into their own resources to cover the costs. Also, you might want to do a little background checking of your own on, you guessed it, social media.
I think you really do need to check Google and social media accounts for the candidates, because often you will pick up from their postings choices that might suggest poor decision making. I remember we had a candidate that had all sorts of questionable tattoos on her body, which we saw on social media and wish we hadn't seen.
If the entire process of finding good home health care seems overwhelming, you may want to try the free services of someone like Jan Sachek, whose 40 years in the field makes her an ideal guide to get you started on the right foot.
The reason that I implemented the complimentary resource service is that so many people I talk to don't know where to start. And that is where I can help, just getting them the information with the expertise and knowledge of at least knowing where to start is a big part of it.
Home health care can be challenging for the patient, their family, and the home health aides providing that care. But positive outcomes are possible.
Attention to the care, feeding, making sure they eat, are bathed, ambulated, not just sitting in a chair doing nothing. Try to stimulate them, and these people will come back.
Our second segment here is an even broader concern, the people who can't get good access to doctors and hospitals, and there are many, many more than you might imagine. Wendy Rutledge continues now.
My husband became disabled, and he was the one that carried the insurance for many a year. So once he became disabled, it dropped me. I've worked all my life. I mean, I was on my job for like 25 years, and then I just went part-time to what I'm doing now. So we working citizens, you know, we've been here a long time, working hard, grinding, living our lives, but it's sad that we don't have insurance.
Newly uninsured after working years in a Publix bakery, Veronica Dale knew she needed a mammogram.
Me and my husband didn't have insurance. It was just kind of difficult because I was calling around and I'm like, oh my God, this is very expensive.
Veronica is one of the lucky ones. She found Care, one of the federally qualified healthcare providers in West Palm Beach. Through a partnership with the Promise Fund, Veronica and many women like her are now able to get life-saving mammograms and pap smears.
This is very personal to me. I'm very passionate about the work that I do because I make such a great difference in their life.
LaBun is what is called a patient navigator. She reaches out to women who are medically underserved, and those numbers are staggering.
Roughly 80,000 women in this region who, for cultural, economic reasons, are disadvantaged, not getting the care that they need.
Sadly, it is this huge underserved population who become deadly victims of late-stage disease, another staggering statistic.
For the last 5 years, according to the data we have, in Florida, over 15,000 women have died of breast and cervical cancer. We believe a lot of it unnecessarily because it just wasn't detected early enough.
Florida ranks 49th out of 50 in terms of health care benefits to women. Longtime Palm Beach resident Diana Barrett, who has been working and studying the issue of disparities in healthcare for many years, says COVID-19 adds yet another serious threat to the medically underserved.
Here I am, a beautiful day in Palm Beach, with every advantage known to man, and I have this beautiful house and I'm incredibly privileged. And there are people who are living in all the ways that Dr. Fauci tells us not to live, in close quarters, not wearing masks. I normally wear a mask, I don't have one on now to speak. Not wearing masks, close quarters, in long exposure to the virus. Why? Because they care about their families, they care about themselves, they care about their lives, but they need to go to work. So they're in close quarters at work, they're in close quarters at home. They live in multiple families very often. These are the people who are our frontline workers. They're our grocery people. They're that magic delivery of Instacart that appears magically at your door. These are the people that are getting it. It's people who work for us, who are compromised, and who lead compromised lives, who are the ones that are really vulnerable with this disease. And with every disease, it's not just COVID.
Recognizing the very real disparity in access to healthcare between the haves and the have-nots is also a passionate concern of Palm Beach Civic Association Healthcare Committee member Kathleen Crampton, who worked in the healthcare industry for decades.
We need to make sure that healthcare services are available to people in their communities in environments where they trust the professionals who are providing those services.
Like Care, there are federally qualified health clinics serving the uninsured all over Palm Beach County. Diana Barrett encourages a proactive approach.
Ask questions, talk to people, ask people where they get care, ask people what happens. I mean, ask your housekeeper, which is a good start. Ask her where she gets care. Our housekeeper has 2 children who have had health problems, and she has very little ability to get care. I've been helping her for 15 years get care for her family.
I think it's important that Palm Beachers recognize the concept of social disparity. It's become a real concept now. And there's social disparity in medical care, medical attention. We need to correct that and make sure that every single citizen is cared for properly. I would suggest that if you had to make one particular phone call, it would be to the healthcare district and identify the fact that this individual needs to get in contact with them.
Meantime, the value of early detection for all women is nothing short of amazing.
We know that if we can detect these diseases in early stages, in stage 1, breast and cervical cancer are practically curable today.
An eye-opening wake-up call to Healthcare Committee member Mary Watkins.
When I was at the Healthcare Committee meeting, Nancy Brinker, who's amazing, said something that was just fabulous. She said 90% of the deaths from cervical cancer and breast cancer can be prevented with routine care, early detection. Wow, that was just eye-opening. But we need to get that word out. I'm going to change my attitude towards this, and we need more people to know that that's the exact approach that we need to take.
Healthcare is a universal need shared by the privileged of Palm Beach and the needy thousands in our county. A universal need, but sometimes a lonely worry.
I worry about going to the hospital. That's my biggest concern.
Leaving Veronica Dale and many of us to ponder this.
I think that it's really sad because if you look at the other countries and you hear about, their healthcare system compared to ours, with us being a very wealthy country, it's sad that we don't have insurance the way we should.
That concludes what we consider an important program for all of you, and we want to tell you that if you'd like to see it again or refer someone to it in town, it's on palmbeachcivic.org into perpetuity. We leave them up for a long time. And we urge you to watch our newscast published and broadcast and emailed to you every Thursday. We'll talk to you soon.